The Russian President Vladimir Putin has launched a coronavirus vaccine touted as the world's worst such vaccine. Now, the registration for the vaccine has laid ground for mass inoculation even as the final stages of the clinical trial to test the safety and efficacy continue. So the final stage of the vaccine trial is still continuing, but President Vladimir Putin has said that his own daughter has already been inoculated. He claims she was a part of the experiment, and he also says that this is the first vaccine offering sustainable immunity against the coronavirus. This morning, for the first time, the world has seen a vaccine against the new coronavirus. This vaccine was registered in Russia. This is what he said during a televised video conference call with government ministers. One of my daughters had this vaccine, I think, in the sense she took part in the experiment. This is what the Russian president had to say. Russia has been pushing hard to develop this COVID-19 vaccine and has said earlier that it hoped to launch mass production within weeks and turn out several million doses per month by next year. How has the World Health Organization reacted to this is, of course, the big question. Well, the WHO last week urged Russia to follow established guidelines and to go through all the necessary stages to develop a safe vaccine. We're going to break down the details of this big story for you. I want to first go across to a very special guest joining us all the way from Moscow. We have Tatiana Kukhareva. She is the head of Sputnik International. Thank you so much for being with us on the broadcast today. It's a big day. We also have Deepak Paliwal. He's a volunteer for the Oxford vaccine. He's joining us live from London. And we have Dr. Rommel, Tickoo, the Associate Director, Internal Medicine, Max Healthcare, joining us from New Delhi to basically help us understand this big international story. But let me first go across to Tatiana. Tatiana, the vaccine is going to be called Sputnik 5. It's named after the Soviet satellite. It's a big announcement that your president has made today. What more can you tell us?
Well, you've actually covered all the bases. President Putin has said that the vaccine has been now registered, and he's also expressed hope that mass production can be launched shortly. And we've just had a media conference with the head of the Russian Direct Investment Fund. We've also participated in the process of the development and the registration of this vaccine. He's announced that Russia has made agreements with 5 countries in order to start the mass production. So that's the gist of it, I would say.
Right. I have to, though, address the international skepticism, Tatiana, because that continues to remain a cause of concern. And I want to understand, how is Russia responding to this at the moment? The vaccine is still in phase 3 of trial, if I understand correctly. But your president has moved for it to be registered as the first official COVID-19 vaccine.
Well, if I understand your question correctly, and how is Russia responding to criticism, I do believe that that's not quite the job here. It's a vaccine. It's the first vaccine, indeed, to have been registered. We have had good results. Our medical experts have commented extensively on those results. I beg your pardon, I'm not a medical expert, so yes. I will not, I'm not prepared to go deeply into the process and answer medical questions, that's for sure.
No, we have a medical expert on the broadcast and we'll pose some of those questions. But I want to understand from you, has there been any reaction or any response to the international criticism in Russia? There are 38 participants in this trial. It's happened all very quickly, so there is criticism coming in on whether due process was followed. There are a whole host of questions at the moment that the world is asking. My question to you specifically, Tatiana, is whether there's been a reaction to that skepticism.
There has been a reaction from the said head of the Russian Direct Investment Fund.
Okay.
Kirill Dmitriev. He's actually spoken out and... Hello?
All right. Yeah, we can hear you, Tatiana. Go ahead. All right. We seem to have lost that line with Tatiana. We'll try and... Yeah. Can you hear me, Tatiana?
Yeah, I can hear you fine.
Okay. We can hear you fine as well. You were answering my question on the skepticism and how Russia is responding.
So, yes, the Russian Direct Investment Fund has spoken out. They've said that the whole idea of criticism is a very particular one. It's peculiar that there is so much criticism towards the vaccine, although it's very well known that Russia was among the first countries to have actually started developing the vaccine. So the whole idea of the criticism and that amount of criticism that we're facing is nothing more than an attempt to, it's a smear campaign against the vaccine because the competition...
Right.
I can't hear you again.
So you're saying that this is a smear campaign because Russia has in fact come out and registered the first vaccine. That's a very very interesting. But what's also interesting here is the fact that Russia is very ambitious with this plan. There is a plan to to develop several 100 million doses of this vaccine by the end of next year. Tatiana, can you hear me?
No, I'm sorry. Just go back the line.
There's a very ambitious plan with the vaccine. There's already a roadmap that's been laid out to produce several 100 million doses of the vaccine.
Well, there's a pandemic that's ongoing, and the world, the population of Russia, for one thing, and I'm sure the rest of the world, is indeed in need of a vaccine. So I don't think that trying to fulfill that need is in any way, shape or form ambitious.
All right. Tatiana, appreciate you joining us with your perspective and, of course, laying out some of those details of the vaccine. Let's take this then to the medical experts. Let's try and understand whether or not this vaccine is indeed safe and efficacious, or is the criticism of this being a rush trial actually fair? Let me take this to Dr. Tickoo straight away. Dr. Tickoo, it's been, a big day with Russia coming out and claiming that they've actually been able to develop a vaccine against the coronavirus. But what's your take? What's your initial reaction? Are you extremely optimistic, as Tatiana was, or are you also a bit skeptical of the speed at which this trial has been conducted?
Well, I'm a bit skeptical, I would say, because Russia does claim that it has successfully completed phase 3 clinical trials of one of the vaccine candidates, which is in development in Russia, and they have done a conditional registration also. They're in the process of doing that, and they'll soon start mass production in September and administering the vaccine in October. But let me tell you that they haven't published any findings, and WHO, which is keeping a close track of vaccine development, has not mentioned it really. So vaccine development is actually a very complex process, and it takes years actually. But in this case, because of the pandemic, we're hopeful that in 1.5 years, we'll have a vaccine in place. But it has to go through the stages. The preclinical trials and the clinical trials take a lot of time, phase 1, phase 2, phase 3. So whichever vaccine we have in place has to be safe and efficacious at the end of the day. Because if it's not safe and efficacious, then apart from having a negative impact on your health, it gives you a false sense of security. And so we should have something which is safe and efficacious. And wherever vaccine development is happening at the end of the world, we should know that it has to be done properly. Established guidelines have to be followed. Because if protocols and guidelines have not been followed, then we are in trouble. But because you don't have to cut corners. Fast tracking the process is fine. But at the end of the day, one has to be very sure as to what you're administering, because people's life is at stake. So what I would say is that we should not be cutting corners. Yeah, fast track the process, but you have to be very sure before you start inoculating. And even in this case, though they have sort of done a temporary registration, but I think parallel trials are going on.
Yes.
So we need to watch closely. Let's keep a track of what's happening. I'm sure other organizations, including WHO, is also keeping a track of it. So we'll see how it unfolds. Can't really say, though they do claim that the trials are successful, but let's see how it unfolds in the next few months.
Okay, I want to put this in perspective for our viewers, and we have Deepak Paliwal joining us on the broadcast. Deepak has actually participated. He's a volunteer in the Oxford trial that is still undergoing. Oxford is, remember, in phase 3 of trials. Deepak, you know, it's been a very interesting development that's taken place today. And I also want to just tell our viewers that the clinical trials for the Russia vaccine actually began on the 18th of June. There were 38 volunteers who've taken part, and all of the participants have developed immunity. The first group was already discharged on July the 15th. So that's in less than a month. And the second group was discharged on July the 20th. So this is all, you know, to just put in context the timeline and, of course, the number of volunteers. Deepak, you know, tell us a little bit about your experience. You've participated in the Oxford trial. What's the process and the timeline been like?
Rishika, thanks for inviting me. First thing, I think we started on Oxford. My process started on 16th of April, and today we have just completed over 90 days for when I got the shot first. So it sounds very absurd to me that within this short period of time, anybody can complete the trial. And we have been hearing this, and I'm fine. I mean, if Russia has developed a vaccine, we are not into a vaccine nationalism right now. We need a vaccine. But as Dr. Tickoo was saying, we need, being a pharma professional myself and involved in all those many clinical trials, I think we need some data from any authority. WHO stated 6 trials going on in phase 3, and Russia was not even mentioned over there. And if the vaccine is working, it's good, but I don't think so. It's such a short notice where you can announce a success. So
Deepak,
I've just completed.
You know, just break it down for us. You're saying that you were given the first dose of the Oxford vaccine back in April. What's the trial process been like? You know, just for our viewers to understand the parallel.
On 16th of April, the registration started.
Okay.
I got the shot on 11. I think there's a connection issue.
We can hear you just fine. Go ahead.
Okay, you can hear me.
Yes.
Okay, so I got my shot on 11th of May, the first shot. And then there was a regular follow-up. Every day there was a e-diary to be filled. Then I was checked on 7th day. Then they called me on 29th day. They saw the first result the phase 2 result got released 25 days back.
Right.
And the phase 3 started. And the sample size was huge. Sample size was 1,000 healthy volunteers for phase 2 and 10,000 healthy volunteers for phase 3 in multiple countries, you know. In Brazil, in South Africa, they started in India and in UK. So you can't have a trial based on 38 individuals and announce it.
Right. Okay. I'm afraid I'm completely out of time. We do need to address some breaking news that's coming in. But Dr. Tickoo, very last word to you. You know, I know that you're erring on the side of caution. But how would you respond? You know, we've heard the parallel. We've broken down the timeline as far as this Russia vaccine is concerned. We've also heard from Deepak on what the Oxford trial was like. You know, your closing comments. How do you look at today's developments?
Well, as I said earlier, it takes time, and I'm hopeful that in the first quarter of the next year, we'll have a vaccine in place. But as everyone has been saying, it has to be safe, efficacious, and it takes time. Let's not be in the rat race that we should be the first ones to develop a vaccine, because at the end of the day, your health is at stake. So I would say whichever vaccine it is has to be safe, efficacious, and don't cut corners. Take time.
Okay. So all good things take time, and a vaccine, whenever it does come out, should be safe and efficacious. That's, of course, the priority of not just healthcare experts, but I think every single citizen who will be administered a vaccine in the world. Thank you so much, Deepak Paliwal and Dr. Rommel Tickoo, for joining us on the broadcast on that big story.